Y'all, I'm trying to tell you, comfort me, y'all, because we are going on this live. I keep hopping off, hopping back on, and I can't grab my person. But that's okay, because you know what we do? We just adapt. If you can't adapt in life, then what are we doing? We still gonna have fun, but we gonna be serious, y'all. Here we go. Hey, Adrian.
Hey,
Instagram would not let me be great. I was like, accept, accept, accept. And I was like, you know what? What do they say? Turn it off, turn it back on.
exactly.
That is what it's going to be. I'm seeing some awesome, awesome people come in. Before we start,
Yes,
just say, how are you doing today,
I'm
Adrian?
doing well, honey. IG would not let you be great. Like I was on the live, but I couldn't see you, but you couldn't
And
see me.
I'm trying to tell you, that's what we got to do. We got to, also want to say hello, beautiful ladies. We are beautiful, aren't we? All
Hello,
ladies are.
hello.
We take care of business.
Yes.
Yeah, well, I really appreciate you taking the time to join. For everyone, my name is Bettina, owner and operator of Be Joyful Comfort Coach, and today I have the amazing, incredible Adrian May with me. She is owner and operator of Moving Forward Diabetes Management. And Adrian, y'all, I I she is just lovely. Yeah, y'all just got to take my word for it because I'm not sharing her. I'm not. I'm not. Y'all just got to take my word for it. Adrienne is so lovely, but she is very serious too. She is a registered nurse, has been one over 20 years. She is specializes in pre-diabetes management.
Mhm.
And y'all follow her right now. If you don't follow her already, we're not going to wait till the end. We're going to wait till now.
Okay.
Go ahead and follow Adrian May right now, because if the diabetes does not apply to you, I know it applies to somebody we know, because so many people, one in something, and the something is high, is affected with diabetes. Adrian, you can tell me what that other something is.
Say that one more time. I'm sorry.
One in how many are diabetic in America right now?
So, so when we talk
Approximately.
about, yeah, so like when we talk about just
Oh,
pre-diabetes,
excuse me.
according to the CDC, no, you're fine, you're fine. When we talk about just pre-diabetes, according to the CDC, over 96 million people are diagnosed with just pre-diabetes. We're not even talking about type 1 or type 2
Guys,
diabetes.
listen, I mean, we love to have fun. We love it when the warm weather comes, like now, because, this is when everybody comes alive. We start doing
Mhm.
all the things that we enjoy doing. But to be able to do that, we have got to be mindful of our health.
Yes.
I am somebody who is guilty of not being mindful of her health and paying for it later on. But thanks to Adrian, I am working on it. She posts a lot of good content and everything like that. So today, hey, everybody who's on,
Hey guys.
um, we are going to talk about the connection
Hmm.
between diabetes
Yes.
and depression. There are
Yes.
a lot of correlation and common factors in there. So
Mhm.
I'm just like you all. I'm super excited to know what Adrian has to say. So I'm gonna let her have the floor. So tell us, start from the top, Adrian, or whatever's on your mind.
Okay, well, thank you guys for, first of all, taking time out of your day, taking time out of your evening to join in with us for this conversation. It's a conversation that a lot of people don't really talk
For
about or
sure.
don't even really think
For
about.
sure.
And I love you, Bettina, for just sharing your knowledge with us as well, because a lot of times you have people that have diabetes or dealing with different mental illness or different symptoms or signs that they may not want to talk about or may not want to address. And then you
Yep.
may have family members that don't know how to say the
Very
quote unquote right thing to them, you know?
very true.
So, and please forgive me, for some reason my phone keeps
Oh,
sliding
it's
down. So you may
okay.
see the top of my head
It's
or the bottom of my head.
okay. It is all right. It's all right.
So, yeah, thank you for what you do. being Be Joyful Comfort Coach, because what you supply for people is very valuable. And I always tell you, we need you. Don't go anywhere. We need you. So,
you do.
yeah, we need you. We need you. So I always, like you said, thank you for the amazing introduction. I have been a registered nurse for over 20 years. My passion is diabetes education. Been doing diabetes education for over 15 years. So most of my nursing career, I've been doing diabetes education. And I do it because I see it in my family. I've had family members to pass away from complications of diabetes. I've had family members to be on dialysis as a result of diabetes. I've had thousands of patients, unfortunately, lose limbs, losing toes and legs and just, heart attacks and strokes. So that's why I stay in diabetes education, because if we can help one person, they can share the information with, their family members.
Right.
So another thing I do want to talk about is my book.
Woo, please tell us.
So
what is it?
I am an author. Thanks be to God. I don't take any credit for this. So I do have a book called, I'll just show it to you guys. It's called Beating the Sugar Beast. It's lifestyle management for people of color living with diabetes. So I really wrote this book, like I said, because I'm a nurse. I've seen thousands and thousands of patients have diabetes and have the complications. So just wanted to write a book to address, diabetes is a beast. It is. And when we say beast, I mean, you can think of it as like literally a beast, like being a monster, or you can think of it as what changes can I make to make the changes to have a healthier life. Correct. So my book is available on Amazon.com.
Hey, y'all.
and it's also available on my website.
You all can go ahead and get it, because I've seen what you all pay for in makeup and gym shoes and Chipotle. So go ahead and support her. And not just support a small business, but you're literally gaining knowledge. I mean, I get it. We come home from work, we scroll on the social media because it's like a way we decompress. I'm guilty of it too, but take a few minutes from that and just take some time and take a page, get that book, read it just a little bit a day, because then you'll learn something you didn't know, and then what are you going to do? Want to share it. So thank you for making sure you let us know about that book, Adrienne. That's going to be so helpful.
You're more than welcome. You're more than welcome. And I geared it towards people of color, but really diabetes is diabetes. But as African Americans, as people of color, we do have different barriers and different disadvantages that other populations may not deal with. So I did gear it towards people of color.
For sure.
But I said all that to say this, just talking about our presentation today, diabetes and depression, it's really an unknown connection. Most people don't really associate diabetes and depression together, but there is a connection. There is a connection. There is a connection.
There is.
And I see it. I see it. Excuse me. My son decided to dial in on IG tonight, so he wanted to make sure that he was available as well. Go back, baby. Go. I'm on live. I'm on live. So go upstairs. Go upstairs. So thank y'all for dialing in. Make sure you listen. Make sure you listen. Okay. Thank you. I'm on. Okay. Okay, baby. Thanks, boy, mom. Okay, baby. Thank you. Thank you. Thank you. All right. So talking about this is real life stuff, guys.
That's what we want. That's what we want. And that shows what you juggle. You juggle mom, wife, diabetes management, back to mom, back to mom, back to mom.
Yes.
Want to be away from
so, and they're so funny. So I told them that I was going on IG Live, and they said, well, we're going to follow you and watch your live. And I was like, no, you're not. But they really did. But they really did.
Girl,
oh, my goodness.
Don't test those boys. Don't test those boys.
I know, right?
Don't test those boys.
So getting back to diabetes and depression, a lot of times people are suffering with depression, but they don't really want to talk about it, or they don't even really know what it may be.
Right.
And I'm sure you probably come into this. So a lot of times when people have depression, they may go into a shell, or they may become isolated where they don't even want to talk about it.
Correct. So
when you have, say, like a family member that said, I have a daughter or a son, or even maybe a spouse that has depression, like what tips would you give them as far as things to comfort them when they are dealing with somebody with depression?
And And you're so right. There's stigma involved. There's confusion, and it's hard because a lot of times we see our family members one way, and we don't realize there is another way, especially with the family who has depression. I really would encourage them to first, you got to be patient, because if you're in the early stages of depression, everybody's depression is different.
Yes.
So what one person, well, this person has depression, they're able to do this. That has nothing to do with that person's depression.
Exactly.
Nothing to do with it. So I would be very patient and say, hey, I can tell something's off with you. Something's different. What do you need from me? What do you need from me? Because sitting there trying to figure out, well, something's wrong with Adrienne. I'll do this too. I'll throw that at her. I'll throw this at her.
Yep.
Find out what does she need, and be prepared for the answer of, I really don't know. Be prepared for that.
Yes.
Because that's probably going to happen.
Yep.
So, okay, well, I'm going to sit with you for an hour or so, maybe we can go on a walk, but first, don't attack with the, well, you just need to get up and do that, because this same person may have just been happy the other day or an hour before. So you have to take people where they are in the present.
Oh my gosh, that's so good. That's one of the things we always say is reach the person where they are.
Right.
So, and then, like you said, it's just like an individual thing. Everybody's not going to be the same in the way that you approach them, or maybe, like you said, they may not even know what they need. They may not even know what they need at that time. Gosh, that's good.
They don't.
That's good.
They don't.
And one of the biggest things, with diabetes is it's not like a cold. It's not like you can just be sick for maybe 3 to 5 days or maybe 7 days, take medication, treat it, and you're done. Like when we talk about diabetes, we're talking about a chronic, day-to-day condition that you have to manage. And if you don't manage it, you can have very severe complications.
Yes, you can.
So
yes, you can.
That's one of the biggest things. And I know another thing I was looking up, diabetes distress. A lot of people don't really think about diabetes distress, but when you have to do something over and over again repetitively, and like with diabetes, if you don't, say, check your blood sugar, or if you have to take insulin, or if you have to take medication by mouth, if you're not taking those, you can possibly have high blood sugar numbers where you go into a coma. You can lose consciousness. Like, it can have severe complications. And with diabetes distress, people are just kind of stressed out, anxious. They may get tired of doing this thing over and over, so they become overwhelmed. So when you talk to people about maybe being overwhelmed or being stressed out or having anxiety, would you give them the same tips, or would it be something a little bit different?
It's very similar. They don't really know what's going on with their body. They know they don't feel well. I mean, I have, even went as far as say, for some, not all, again, for some, not all, giving them time to calm themselves down is very important, because only I know how to calm myself down. When I spoke about it in one of my posts, a deep inhale and a deep exhale, repeated, is so helpful. I mean, that is so beautiful how our body is made, that it balances it out. So if someone has, hey guys, see a couple of other people joining. If you have family member who has anxiety, that's so tough, because it really exploits your loved one. It exploits their emotion. We may have like, oh, I'm a little nervous. Like, I was a little nervous about this live today. But anxiety will take that and pull it into something that you can't even function. So I encourage family members of ones who have depression and anxiety, please let them tell
Mhm.
you what helps, even if
Yes.
that is, I don't know.
Exactly. Exactly. And I totally agree. I also think that one of the things that I also see with some patients and some clients is that they feel like it's a stigma associated with having diabetes.
For sure.
So they feel that, oh my gosh, I've been diagnosed with diabetes. Oh, that means I didn't take care of myself. I know grandmama had diabetes. I know my mama had diabetes. So now I have diabetes. I'm not taking care of myself. I'm not doing what I need to do. So I should have just did better. So now they have this stigma associated with it. And then also I've seen for some patients, even discrimination, depending on their profession.
For sure.
They may have different criteria that they have to meet to be able to do their job.
For sure.
So, it's just a lot to think about. So you got all this, so you have a new diagnosis of diabetes. Or I have one patient that's been diagnosed over 20 years, mid 40s. So, was diagnosed late, early adulthood. So has already lost a toe. We're dealing right now with an infection. So sometimes when you have this diagnosis for so long, you're stressed out, then you have a stigma, and then depending on maybe your profession, you may even have discrimination or other hoops to jump through to be able to do your job.
Yes. Everything you're saying is so spot on, Adrienne.
Oh.
Because I'm seeing not just others, but myself.
Mm-hmm.
We had a health fair at work.
Okay.
And they were like, hey, we're going to get your blood work. We're going to, take blood pressure, did the whole panel. And I'm just at
Mm-hmm.
the desk. And they were like, Bettina, your A1C was very high. And I was like, me?
Mm-hmm.
And I was like, I'll go check it out. Or it's probably not that high. I mean,
Mm-hmm.
what I always say, I'm just tall for my age. I saw the scale. I saw the numbers.
Yeah.
I'm tall.
Mm-hmm.
When I went to the doctor, he was like, your A1C, now brace yourself, Adrienne, brace yourself.
Oh no.
12.
Oh wow. See.
Now, I have worked to get it down to, let me see, when was the last one? It was 7.2.
Oh, that's good.
Yes, I worked
That's
to get
good.
7.2.
That's good.
And I'm hoping, because every 3 months, the doctor checks it. And guys, 12 is very high, very bad. But a lot of the things of why it was high was my depression was bad at that time too. So I'm eating what I shouldn't be eating. And that's why I'm so glad you and I are even talking, because the correlation between depression and diabetes, they are neck and neck with each other. They are next door neighbors. They are next door neighbors, because it's common that one will bring on the other and vice versa. And I know for myself, that's why I'm so appreciative of your account, because it did make me feel like a failure, made me feel really bad. It was like, you're already getting older, and now you have diabetes. And I was just like, oh, I can't do anything right, But that's why I appreciate your page. You give so many practical tips on how to manage, a lot of different things when it comes to diabetes. And I really just want to make sure I convey that to you about how much I appreciate it. Because that's how we first met first was, I was like, man, this page is so helpful.
So I'm so glad to hear that my page has been helpful, because I don't know, all of the people that are currently watching us, if you are content creators, or if you have an IG page or a Facebook page, or if you provide a service.
Right.
But sometimes you think, okay, like, I'm putting this information out here. Is it helping anybody?
Right. Sure.
So I'm glad to hear that it has been helpful. That's one of my major goals, is to provide education. That's why I've done diabetes education so long, population health for so long, case management for so long, is just to get the information to the people, to the patients, to the clients, to people that need it. So I'm glad that it has been helpful.
Incredibly helpful. It's incredibly.
Great, great.
Yeah.
So, I mean, so for people that are watching that may not know what an A1C is, and I'm so proud of you to get that number down
Thank
because the higher,
you.
that's amazing.
I feel like
Yes, yes,
get some homework and then put it on the refrigerator. And I was like, look, Mom, like,
exactly.
I made
You
you.
get an A plus.
Thank you. Thank you.
You get an A plus because with your A1C, that shows what your blood sugar ranges have been over the past 2 to 3 months. And for most providers, they're looking at A1Cs that's less than 7. Of course, you may have some ranges that may be different based on your health needs, but typically 7% or less is what they're looking at. So if you had a 12 and you went all the way down to 7.2, when they're looking at A1C numbers, they're looking at numbers that actually help reduce the complications from diabetes. So if you're thinking about, heart attack, stroke, amputations.
Y'all listen, Adrienne, this is why I appreciate her being here, because she is somebody who has the busiest schedule. And I just appreciate her taking this time, y'all, because let me tell you, she is somebody. Look, she got her son. She takes care of her kids, y'all. She's so involved with her kids. And I love it because she's passionate about her kids. She's passionate about her work. Y'all go follow her. Follow her, buy her book, because we are talking about, we're ready for the summer and all that, and health is wealth. I see y'all's posts and all this other stuff. You all, we got to actually do some work. We got to go from makeup to mud, as I like to say. We have to put in the work so we can live some happy lives. I love when the summer comes and it's just a time we all get out and we have fun. But what good is it if our organs are pleading with us to get healthy? It's not cute. Let's do some selfies on some blood panels and whatnot. But I digress. But guys, it's so important between diabetes and those who have depression. Please make sure that you are taking care of yourself first. You have loved ones who have depression, who are battling with it. Please be patient with them. It is a horrible disease. I have suffered with it for almost 30 years. It's been 29 years. And I will tell you that every day I learn something new about my depression. I did not know that it could dictate parts of my life, and it's just crazy. Oh, my light went out. Hold on. Let's make sure I get that back on for us, because the light with Bettina, that ain't no fun. Hey, Adrienne. Look, you were going to light.
Sorry,
I need
guys.
that light. I need y'all to think I'm cute now.
Goodness,
I need y'all to think I'm cute.
you are
But yeah,
cute.
oh, thank you. Thank you.
Oh,
Yeah.
goodness. So sorry about that.
No, please don't need to talk.
Oh, hashtag boy mom. If anybody has boys, hashtag boy mom.
That's it. My friend, who she has 2 boys, she says, I hate it here, Bettina. Like it's her kids. Oh, it's awesome. Anyway, so no, you
Yes.
are fine. Our like to see real life stuff. They don't like the plastic aesthetic stuff. They don't, because they can't relate to that. I like to be relatable, and this is relatable. To have a job that you have to do, you're trying to maintaining your business, being a mom, Adrienne, you're killing it. You are killing it.
Oh my gosh.
Don't think it's
So
different.
thank you. So yes. So I don't know what you said while I was gone, but I did just want to congratulate you about your A1C numbers.
Oh, thank you so much. Thank you.
Yes.
I recognize too that my A1C, what I ate, also had a bearing on my depression.
Mm-hmm.
How bad my depression episode would get. Like when it comes to depression, and I'm sure you'll agree, when it comes to it's not just one thing. You can't, I'll take my diabetes medicine and I'm good. No.
Nope.
You need to exercise.
Nope.
You need to eat.
Yes.
And you need to educate yourself about it. Like there's so many different steps, and that's the same with myself and the depression. It's not just my antidepressant that makes things better.
Mm-hmm.
make sure I eat right. I must make sure I
Yes.
exercise. I must make
Yes.
sure, medicine is a part, but there's so many different things. Just like the human body,
Yes.
we can't just walk around with just the hand. You need every part. Every part.
Exactly. And that's so true. That is so true. And I did want to just tell people, if y'all have questions, drop them in the chat box. We're here.
Mhm.
Yeah. So if y'all have questions or comments, feel free to drop them in the chat box. We're here to help you as much as we can. But you're exactly right. Diabetes management isn't just one thing. It isn't just taking your medicine, but maybe not checking your blood sugar, or if you have like a continuous glucose monitor, not using it, or not moving, not doing activity and movement.
Right.
It's a combination of so many things. So many things.
So many things.
One of the things that I saw on the CDC website is, according to the CDC, people with diabetes are 2 to 3 times more likely to have depression than people without the diagnosis. That's a
Really?
huge number. 2 to 3 times.
That I did not know that.
Yes. Yes. Yes.
Even more of a,
So just thinking about that, that's a huge amount of people.
it's a huge amount of people
Mm-hmm.
who are dealing
That's a lot.
in depression. I'm telling you, they are neighbors. They are next door neighbors. They are right next to each other.
Yep. And then I was also looking at the website, and they said in any 18-month period, so we're looking at like a year and a half, you're talking about 33 to 50% of people with diabetes have diabetes distress, which is not actually the diagnosis of depression, but it's actually the feelings of stress and anxiety and feeling overwhelmed with, like you said, trying to manage everything you need to manage for your diabetes.
For sure.
So whether it's checking your blood sugar, or healthy meal planning, or activity and movement, like that can become overwhelming.
It can.
So
it can.
Up to 50% of people are like, oh, let me just kind of take a break,
And see, the thing is, when we're talking about diabetes and we're talking about depression, we're talking about things that are so important, but they get to the wayside because if you suffer from both or either, you're thinking, I can't add this on top of everything else I'm dealing with.
Yep.
We are taking time today to let you all know, no, these things need to go to the top of the list.
Yes.
Because
yes.
you don't have your health, whether it's mental or physical health, right point. Everything else doesn't matter. Work doesn't matter. Your hobbies don't matter. Recreation doesn't matter because you won't be well enough to be able to do any of those things. So guys, listen, we have got to get serious in 2023 about actually, I use that term, boots on the ground, like actually putting in the work. And I'm not just talking to y'all, I'm talking to myself too.
Yeah.
I really enjoyed that live you did a few days ago with Tamara with Eye Care Services. And she said, guys, we're going to do the no sugar, no salt, no dairy. And I was like, does she mean that? Does she mean it? And do you know what I did this morning? I had in my mind, I said, I'm not going to have any sugar, any salt, any dairy. Like and this has been so hard, but that's what I've been focused on today. And I'm
good.
Up online to see what can my snacks be. I said, I know I'm gonna go to Kroger to get my oranges. I had some blue morning, I had some pineapple because I have a sweet tooth. I got my water. I've been drinking my water. Like,
right?
This is difficult, guys. This is so difficult, but anything worth having, you have to work hard for.
Yes. So true. So true. It's so funny you say that because, so Nurse Tamara and I did a live on Friday. And it was about stroke prevention and pre-diabetes management.
Right.
And she's given us a 7-day challenge starting tomorrow. No added sugar, no added salt.
Right.
And I was thinking the same thing, Bettina. I was like, okay, get your mind right. Get your mind right.
Get your mind right.
Get your mind right.
Get your mind right.
So, I was thinking the same thing. I was like, okay, I need to do some really meal planning, meal prepping to get it together.
Yes.
And then also balancing activity and movement, just trying to think like, you know, because I'm teaching you guys this, I need to definitely make sure I'm doing it as well.
I'm telling you, it's
Yeah.
as I'm getting older, I'm learning. First of all, I was just 21 yesterday. Like, I was just young. I was just young, and I'm still young. You know, I'm 41, but thinking about my body does not get rid of fat like it used to. My body does not like, you know, I went to the doctor for my spine. I was like, is something on my back? What's wrong with it? Is it broke? Is it broke? She's like, no, you're just older. And I was just like, oh. I mean, you know, but that's reality. That is reality.
Yeah. Yeah. That is reality. Yeah.
Posting instead of selfies our blood panel. You know, let's start posting that, and I bet we'd be some tightening up.
Oh yeah, oh yeah, oh yeah. Exactly. I totally agree. I love the part where you said your physical health is just as important as your mental health. I think for so many people, I know African American people, because like I tell people, I've been Black all my life, so I can only speak on being Black, being African American. I know for what I've heard when I was growing up, like if people say like you're crazy or this or that, or if you verbalize issues with your mental health, they'll say, oh, you're crazy. And that's a stigma. Like, you're not crazy.
Yes.
Like, you have mental health issues that need to be addressed. And people will say, oh, well, I'm not going to see anybody about it. Please do. Like, if you need a therapist, please do. If you need to be on medication, please do. Because that's really the only way that you're going to be able to get the help that you need.
Right.
So don't let the stigma of getting help be a crutch or a hindrance, because we have psychiatrists and psychologists and licensed clinical social workers. We have people that can give us talk therapy. We have people that can prescribe medication. We have people that can give you like behavior health techniques that will help you. So don't let that be a barrier.
No. And well, this is a safe space, guys. It's a safe space. I have had apprehension even revealing my suffering of depression, because you know, it's hard to be believable, because you know me, I tend to be joyful a lot. You know, I try to, you know, be positive, but it is horrible, and it absolutely is a stigma, because like you said, in our community, it's, well, did you pray about it? Did you, you know, God will help you, you just got to pray some more. You know, all is a good advice, but that's not the only thing. And if I said, oh, so-and-so has heart problems, oh, okay, I have depression. You know, it doesn't get the same you know, attention or care and concern as something else. So that you're absolutely right. It is a stigma. And I saw Dave Chappelle said one time, he said, I don't use the word crazy. He said, crazy is dismissive. Just love that. And he said that I change Bettina's verbiage. Oh, no, not like I said, you crazy girl. That's not what I'm talking about, of course. And you know, I thought that's so true, and that is so. People don't want to go because of the stigma, and that's why there are so many options. Mental health and all that. Please continue.
No, you're fine. You're fine. I just think that, I mean, I was just reading an article here where we stay. One of our high school kids committed suicide last week. And we should not let it get to a point where our kids they said it was because of bullying. So we should not let it get to a point where our kids are bullied, that they feel such low self-esteem or they don't feel appreciated, that they commit suicide. And I do want to throw this in. We do have a suicide hotline. You can just dial 988. And they can provide you suicide information, and it's a hotline. It's just 988. Just like when you think about 911 for emergencies and you need the police to come, 988 is your emergency for suicide prevention for the hotline. So I I just always want people, when you think about depression and you think about the frequency, not just if you're having a bad day or you're feeling sad, but if you're having a loss of interest in things, you're not doing the things that you normally do. If you're not eating or if you're overeating, if you just don't find joy the way you used to,
Yes,
seek help.
yes,
Seek help.
yes,
Seek help.
yes, yes. That is one of the main things. I had a friend
Mhm.
and I would see her, talk to her, listen, pay attention. And I was open to
Mhm.
my depression and I was thinking, I think you got it too. I think
Mhm.
you do, because the thing
Mhm.
that she used to enjoy, she found zero enjoyment out of doing it.
Mhm.
And
Yep.
sometimes we just really think we're having a bad day, and it's a little deeper than
Yep.
that. And I mean, if we
Yep.
Google something else,
Yep.
Google like what is depression, because I think the definition would surprise a lot of people.
Mhm. Exactly. And I always tell people, I mean, I've done it. I'm human. I've done it. We all wear a mask.
We
So
do.
we all can put on a
We do.
happy, I'm great, I'm feeling good. Everybody can put on a
We
mask.
do.
So don't wear that mask so long that you don't get the help that you need, because we need you. Like, you may not feel like it, but we need you.
Oh,
So the help that you need.
oh, that is don't wear that mask so long that you
Mhm.
need. Oh, that's a beautiful quote. I always tell people, they'll say, "Oh, well, Bettina, you're so happy." So was Robin Williams. So was most comedians. So was, I mean, that's not uncommon, because
Mhm.
we to put on the brave face. Let me read this.
Yeah.
I think it's hard to spot on ourselves sometimes, so it's important to keep a close eye on each other too. You're absolutely,
Yes.
you are
Yes.
absolutely right,
Yes.
and that's
Yes.
another reason of why I felt it was important to, do Be Joyful Comfort Coach,
Mhm.
because about taking care of each other.
Yes.
Oh,
Yes. Yes.
but in
I
ourselves.
think that's a great point. I think that's a great point. Just is more. I think that's a great point. I think sometimes we may realize that we have a problem or issue, but we don't want to bring it to the forefront. But then I know, even for myself, like, I'm a mom, I'm a wife, I'm a friend, I'm a nurse, I'm taking care of everybody else. But what about self-care? And that's one of the things on my content is I always talk about self-care. Even my husband told me today, he said, you got to take out more time for yourself. And I was like, wait a minute, like, I'm teaching everybody else this.
That's
So it is. I mean, it's important for us to check on ourselves and to check on our friends, because a lot of times we don't tell each other. Like, maybe we don't slow down enough to realize, hey, I need to take
we
a
don't.
break. Or maybe your friend, you may see, like you said, you had a friend that you were with and you were thinking, I think you might be depressed too. Like, we just have to look out for each other, because in these days and times, I know they used to always say that when I was growing up in church, in these days and times. But in these days and times, you can just look around. It's so much
It
going on, so much going on.
is.
And for us to live day to day, it's a lot.
It's so much. And I think definitely even the pandemic, I mean, that was a revealer of a lot of things within us. A lot of things within us. I mean, I thought it was even interesting that the handshakes, the touches that you get every day
Mm-hmm.
literally cause skin hunger in people. You
Mm-hmm.
We really do need each other. And I know people say, I stay by myself, I'm by myself. Okay, that's fine. You can't do that
Mm-hmm. Mm-hmm.
forever. That is a
Nope.
forever thing.
Nope.
But yeah, I it's important to, but I also stress, uh,
Mm-hmm.
if you're if you don't have that overage and that capacity to give to somebody else, because like you said, Adrian,
Mm-hmm.
you're your wife, you're a nurse,
Mm-hmm.
you're a friend. If Bettina call you, Adrian, I need you, you have to do a self-check, because
Mm-hmm.
that's just important. you know
Yep.
and you can say,
Yep.
hey, let me text, maybe I can text instead of talk,
Mm-hmm.
so that
Yep.
won't feel like so much weight that you're bringing in, so
Mm-hmm.
different,
So true.
just different tips like that.
Oh yeah. No problem, no problem. And then if anybody has any questions, I see Lorinda Web Battle. Facts. Yes, facts. It's a lot. It's a lot to, it's a lot. It's a lot to live in this world today. It's a
It,
lot. I mean, we have so much going on, so much to think about. I know a lot of my clients are talking about inflation and gas and groceries. So we're just talking about living day to
I mean,
day. So,
yes.
you know, and then coupled on with if you have diabetes, and we're talking about, you know, of course, diabetes, but for some people, it may be congestive heart failure, it may be COPD, a lung condition, it may be hypertension is uncontrolled. They may can't afford their medication. So
Exactly.
it's so much to think about. But if y'all have any questions, feel free to put them in the chat box. I'm going to put my website in here as well. I also offer discovery calls, one-to-one session, 15-minute discovery calls. And then I also offer one-to-one time to meet with my clients one-on-one. If you're having a prediabetes management, if you have prediabetes and you're looking for ways to meet your goals and accomplish where you need to go next. So I'm going to put my website in here too. And feel free just to drop questions for us as well.
And I wanted to tell everybody else who hadn't been on before, Adrienne is somebody who is incredibly knowledgeable with things pre-diabetes. She has been a nurse for 20 years. She has her own business, Moving Forward Diabetes Management. She has been so helpful to me. As how I met her, was seeing her posts and her recommendations. Guys, please make sure you follow her right now. Don't even wait till the end. Go ahead and follow. Also in my, I hear the say it all the time, in my profile, there is a link and you can get 5 free Comfort Coach.
Mm-hmm.
So please make sure you sign up for that.
Yes.
Also, there's some exciting things I'll be doing, but there's going to be possible option of one-on-one coaching. I get that all the time. I'm always that, Bettina, when you do one-on-one, and I'm like, well, I don't think anybody wants that. And I'm like, oh, okay, I guess y'all do. So
yes,
if you all are in that, please, DM me and let me know, and I'll see what, I'll make sure you'll be the first to know when that launches.
yes.
But in conclusion,
Yes.
what are some things that you want people to walk away from in this live? If they have one thing, they're like, oh yeah, Adrienne was on there. They go, what are you talking about? What is that one thing you want them to know and reflect, meditate about?
So if I could think of maybe 3 things that I want them to take away from this live.
Even better.
So I'm sorry. Did you tell me one of them being disobedient? So 3 things that I really want people to take away from this live is, number 1, take off the mask, because we all wear them. Whether you think you may or may not, we do. We all wear a mask. So and sometimes we may just wear the mask to get through the day, and I get it. I understand. But please take off the mask. Please take care of not only your physical health, but your mental health. Because if you're not taking care of your mental health, baby, that physical health going to decline real quick. So make sure you're taking care of your physical health, your mental health. Number 2, don't think that taking care of yourself is being selfish. It's not. It's really not. It's called self-care. And we definitely all need self-care, whether it's, I love your tip of just the breathing in, the breathing out, inhaling, exhaling. It can be something as simple as that. It can be something as simple as getting a manicure, pedicure. It can be as simple as going outside for a walk. Just taking time out for yourself. Whatever makes you feel good, not for the person next to you, not for the person next door, but whatever makes you feel good, that gives you a sense of balance, make sure you do that. Correct. And 3, when we talk about depression and diabetes and any other health-related issue, make sure that you're your own advocate. I can't stress this enough. Like, make sure you're your own advocate. Make sure you know your numbers. If it's pre-diabetes or diabetes, make sure you know your ABCs, your A1C, your blood pressure number, your cholesterol numbers. Right. Make sure that you have a primary care provider. Make sure you have somebody that's keeping track of your health, keeping track of your numbers, and be your own advocate and know what questions to take with you to those visits. Sometimes the visits can be very quick, very short. Make sure you're taking your questions. Make sure you're your own advocate, because only you can really make those choices for a healthier lifestyle.
That is phenomenal. That is phenomenal. And those are very practical things. Those aren't things that are hard.
Mm-hmm.
Those are things that aren't hard to do. And
Mm-hmm.
I really want us all to just try and put forth more effort to not just speak about it, but to actually, you know, do something. Because I was thinking similar along those lines. I was thinking eat right, period. Because eating right is going to be good for diabetes and depression. Get out there and exercise. Those two, that is also good for diabetes and depression. And go to the doctor, because people are quick to go to the gym to work on the physical health, you know, physical fitness. If only we ran to a counselor or a therapist with the same energy. Like you said, if that mental health ain't right, the physical will deteriorate. I know people used to be bodybuilders and they're not anymore, because that mental health is not easily, you know, something you can ignore. You just can't ignore that. So, I mean, that is just so important. And I appreciate it about you, Adrienne, is you're just as passionate as I am about, you know, the area expertise I have, the area expertise you have. We're so passionate about it. I mean,
Yeah.
I'm sure I'm the same way. It's all I think about. You know,
Mm-hmm.
like I put the gloves
Yep.
on and I'm seeing somebody in the store and I'm like, they're not very nice. I bet you they need some comfort. Like, you know,
Mm-hmm.
it's
Exactly.
they're overwhelmed.
Exactly. Exactly.
Someone said too, you know, we're too simulated. What?
Mm-hmm.
Oh, there was another shooting. Oh, whatever. Like, and we not react there, but we may go grab that bag of chips, you know.
Mm-hmm. Mm-hmm. Mm-hmm.
And
Yep. Yep.
that'll be our
Yep.
reaction. It's a lot for us. It's a lot for us. But but
It is.
yeah,
It's a lot.
yeah. But Adrienne, was there anything else you wanted to add in closing? I know you are a busy person, and I really, really appreciate you being with us today.
No,
So was there anything else?
you're more than welcome, honey. I just like I said, sorry, honey, for these children, but
Oh,
life is life.
no, please.
Life is life.
Please don't apologize, because it's what it is. It's beautiful and encouraging, because it's showing how, like I said before, your passion. You have a million other things you could be doing, but you're taking the time to try to reach others and help others to live their lifestyle and to be aware of some dangers. So please, that the I don't really call them interruptions, but I call them, you know, awesome examples of what can be achieved when you're balanced in a lot of things. So no, thank you, Adrienne, so much.
You're welcome. You're welcome. Only thing I really want to say is, again, thank you everybody for who dialed in today. Please like, comment, share with your friends, share the video with others. Let them know that we are out here, what they say, in these streets trying to get the information out. So thank you so much for dialing in. Please follow me on IG. I put my information in the link. And then also my website, I put that information in the link. So if y'all have any questions, please reach out. And you guys enjoy the rest of your weekend.
For Adrienne, again, thank you so very much. Really appreciate it. I'm going to give you an update on my new A1C number.
Yes.
I want you to set up on the refrigerator and give me a heart, a balloon, something. But for your work that you do in the community and everything. I mean, it is so helpful to us, because we have got to break stigma. We've got to break bad habits. We have to unlearn behavior. This is a lifestyle. We have got to be able to be healthy so we can be there for our loved ones, period, point blank.
Exactly. Thank you so much. And thank you guys. Have a great weekend.
Adrienne, you all take care. Thanks everybody for joining in. We'll have the replay up soon. I am Bettina from Be Joyful Comfort Coach, Adrienne May from Moving Forward Diabetes Management. We love you all. We want you all to be safe and healthy, and we'll see you next time.
Bye,
Bye.
guys.